During IVF treatment, eggs are extracted from the ovaries. This is known as an egg retrieval. There is a lot of preparation for that day, and a lot of things are going on behind the scenes in the IVF lab. In this episode of Infertility TV, I will tell you what to expect on this exciting day and show you what happens in the IVF laboratory. The day before your egg retrieval, the embryologists are already hard at work. They are preparing the dishes that your eggs and embryos will be staying in for the next several days and the media that they will be soaking in. The media will be placed into an incubator so that it is at the correct temperature and pH by the time of the egg retrieval the next day. Having everything at the correct temperature is very important for IVF. On the day of the egg retrieval, the embryology team comes in early and starts turning everything on so that it is at the correct temperature by retrieval time. This is also true in the egg retrieval procedure room. The test tubes, which will be used to collect the fluid from the follicles, are placed in special warming blocks. The embryologist will bring in a few tubes of media and then place them in those blocks. More on that later. The procedure staff will set up a sterile area where the doctor will work. An IVF aspiration needle is open, connected to a test tube and to a suction pump. The ultrasound machine is brought over and the vaginal ultrasound probe is covered with a sterile cover and the needle guide is attached. Once the patient arrives, she is administered anesthesia and placed into position for the egg retrieval. The IVF doctor now uses those tubes of media to flush the egg retrieval needle and tubing to remove any toxins that were produced in the manufacturing process. The ultrasound probe is placed into the vagina and the ovary is visualized. The aspiration needle is advanced through the guide, through the wall of the vagina, and into the ovary. Once the tip of the needle is in a follicle, the doctor activates the suction pump and the fluid is aspirated into the test tube. Depending on the size of the follicle, this may be repeated a few times before the tube is filled. The tube is then brought to the embryologist. The embryologist works inside of an IVF isolette. This provides a space where the temperature, humidity, and composition of the gas can be controlled. The isolette has an integrated microscope and armholes for the embryologist. The fluid from the test tube is emptied into a laboratory dish. The dish is scanned under the microscope. Within the fluid are millions of tiny cells from the follicle called granulosa cells. The embryologist will search around to look for the egg. Once it is found, it is placed into another dish with more media as the search for more eggs continues. Once the doctor has aspirated all of the follicles, the patient is awakened and taken to the recovery area. The eggs are placed into an incubator for a few hours. During this time, either a semen specimen is collected and prepared or previously frozen sperm is thawed. The eggs are removed from the incubator. If they are still covered with cells, then those cells are stripped away. This provides the embryologist with their first really good look at the eggs. Only now they can determine whether the eggs are mature. Each mature egg is then injected with a single sperm under the microscope. The injected eggs are returned to the incubator until the next day when they will be inspected to determine if they have achieved fertilization. Fertilized eggs are then allowed to develop in the incubator, and in several days they can either be transferred or frozen. If you enjoyed this episode, check out our video about Embryo Transfer Day to see what happens on that exciting day. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.